my name is Renika Maharaj. I'm a MSN FNP student at United States University, and this is my head-to-toe assessment. I'm going to start off by doing the room scan. So I'm going to grab my laptop. I'm going to start with this corner with my patient, the ceiling, and the roof. We're going to go to this wall and the ceiling and the floor. And then the side, the wall, and the ceiling, and the floor. And then we're gonna go to this side, and the ceiling, and the floor. Perfect. Next, I'm just going to show my ears. I don't have any hearing devices or listening devices to help me. And then next, I'm just going to grab my mirror and show my screen. So here is my screen. Perfect. And yeah. And then before I get started, I also just wanted to verbally attest that I promise to adhere to the student code of conduct and that I am not using any outside sources for help in any way during this assessment. So I'm just going to introduce myself. Hi, my name is Renika. I'm a nurse practitioner student, and I will be doing your head-to-toe assessment today. I'm going to go ahead and wash my hands and put on some gloves. We're going to start off with just kind of some patient identification. So can you please tell me your full name?
Hi, Annette Flores.
Awesome, Annette. And how old are you?
I'm 29.
29, perfect. And so I'm also going to just get some verbal consent. So are you the same person that signed the consent form?
Yes.
And do you consent to be recorded and have this video uploaded on YouTube as unlisted for my professor to view and grade, along with possibly some other faculty members watching for auditing purposes?
Yes.
Perfect. So now that I have consent, I just also want to let you know that this exam is for my course. It's not in lieu of an actual physical assessment. So if we do find any abnormalities during this assessment, please follow up with your primary care manager. Awesome. Annette, if you could tell me your gender.
Female.
Awesome. Your race.
Hispanic.
And your date of birth.
11/10/93.
Perfect. And what reason you went to the clinic today?
Just a wellness exam.
A wellness exam. Perfect. So if the patient did come in with a chief complaint, I would gather a full HPI workup, which includes old cards. This stands for onset, location, duration, characteristics, such as what other symptoms they may have, any aggravating symptoms, any relieving factors, treatments, and the severity of the situation. So, Annette, how is your health in general?
Good.
Perfect. And when was your last physical exam?
6 months ago.
Perfect. And what were the findings of that exam?
Everything was normal.
Good. Did they do any lab work?
No.
No lab work was done. Okay. And do you have you ever been diagnosed with a chronic illness such as hypertension or diabetes?
No.
Perfect. So if the patient did say yes to that, we would ask what they were diagnosed with, what they were diagnosed with, and what the treatment plan was. Annette, have you ever been hospitalized for a mental illness?
No.
Perfect. And then have you ever had any infectious disease such as HIV, hepatitis, or tuberculosis?
No.
Perfect. And do you have any allergies to medication?
No.
Any allergies to food?
No.
Any environmental allergies?
No.
If my patient had answered yes, I would ask them what they were allergic to, the severity of their allergy, and any treatment plans that they are undergoing. And then, are you taking any medications, whether they be prescription, over-the-counter, herbal, or supplements such as vitamins?
No.
Perfect. So if my patient were taking any medications, I would ask them what the name of the medication was, the reason they're taking it, the dosage, the route they're taking it, and the frequency. Annette, have you ever had any surgeries?
No.
Okay. And if she had had surgeries, we would ask what the surgery was, the reason for the surgery, the date she had it, if she was admitted into the hospital, and if there were any complications from the surgery or anesthesia. And have you ever been hospitalized for any injuries such as broken bones?
No.
Awesome. And so we would also ask which bone she had broken, if she had, the reason, the date, if she had to have surgery, if it's fully healed, etc. And Annette, are you up to date on your childhood immunizations?
Yes.
What about the flu vaccine?
Yes, I got it 3 months ago.
Awesome. And what about the COVID vaccine?
Yeah, I got that actually 2 weeks ago.
2 weeks ago. Perfect. So she's up to date on all vaccinations. Annette, when was your last menstrual period?
I just finished it 3 days ago.
Perfect. And how would you describe your menstrual flow?
Regular?
Regular. Perfect. And then, do you have any children?
No.
Perfect. Have you ever been pregnant?
No.
Awesome. And when was your last gynecological exam?
I did it about 3 months ago.
3 months ago. And what about pap smear and breast exam?
I did it 3 months ago.
Perfect. And what were the findings from those exams?
Everything was normal.
Awesome. Everything was normal. And how many sexual partners have you had?
1.
One. Have you ever tested positive for an STI?
No.
Do you use any contraceptives?
Birth control pill?
Awesome. And then are you, how, is it the one where you take daily?
Yes.
Perfect. And are you planning on getting pregnant?
No.
Perfect. So then we're gonna just do some kind of health maintenance. If my patient were a man, I would educate him on doing a testicular self-exam, which is best done after a shower. That's when the muscles in the scrotum are warm and relaxed. The patient would use both their hands to move the testicles between their fingers to examine for any nodules. And then per the American College of Obstetrics and Gynecologists, women who are between the age of 21 to 29, which my patient Annette is, they should have a pap test done every 3 years. And then breast health, we want both genders to do breast exams once a month. They want to feel for any changes in breast tissue such as size, shape, color, and palpable lumps. For women, it's best done 3 to 5 days after their menstrual cycle. We're just going to get some family history from you, Annette. So did your maternal grandmother have any health issues?
She had diabetes.
Diabetes. And is she living or deceased?
Deceased.
And when did she pass away?
She passed away, she was 72.
And how did she pass away?
From, I think just natural.
Natural cause. Perfect. And then what about your maternal grandfather? Did he have any health issues?
No.
And is he living or deceased?
He passed away.
And how old was he when he passed away?
82.
And how did he pass away?
He had a stroke.
A stroke. And what about your maternal grandmother? Did she have any health issues?
No.
Is she living or deceased?
Deceased.
And how old was she when she passed away?
Was 77.
And how did she pass away?
Natural cause.
And what about your paternal grandfather?
He passed away to natural cause at the age of 82.
Okay, did he have any health issues?
No.
Awesome, and let's, we're gonna move on to your mom. Does your mom have any health issues?
No.
Is she living or deceased?
Alive.
And how old is she?
She is 53.
Perfect, and what about your dad? Any health issues?
No, my dad's alive, well, and he's 57.
Perfect, and do you have any siblings?
No.
And how about children?
No.
Perfect. So now we're going to kind of delve in a little bit more into your family history. So I'm just gonna list some things, and you let me know if there's any history of that in your family. So Annette, anyone in your family have blindness or deafness?
No.
Perfect. Any history of hypertension or heart attack?
No.
Awesome. Any history of strokes or seizure disorders?
No.
Okay. And any history of COPD and asthma?
No.
Any history of heartburn or diverticulitis?
No.
Awesome. Any history of kidney disease? Or anyone in your family that was on dialysis?
No.
Okay. And then any history of thyroid disorders?
No.
Perfect. Any history of muscular dystrophy?
No.
Perfect. And any history of obesity?
No.
Awesome. Any history of any breast cancer or any part of the body in your family?
No.
Perfect. And any history of hemophilia or any bleeding disorders?
No.
Perfect. And any history of depression or anxiety in your family?
No.
Perfect. And any history of cystic fibrosis?
No.
Okay, and does anyone in your family have a history of alcoholism or drug abuse?
No.
Perfect. Any family members that have allergies to either medication, food, or environmental factors?
Not that I'm aware.
Perfect. And then could you tell me where you were born?
I was born in Pleasanton, California.
Perfect. And what is your race?
Mexican.
And what is your nationality?
American.
And what is your ethnicity?
Hispanic.
Okay. And are you married?
I'm married.
Perfect. And do you currently work?
Yes.
Where do you work?
I'm a teacher at an elementary school.
Oh, that sounds fun. And have you ever served in the military?
No.
Awesome. And do you live in a home or an apartment?
Apartment.
Perfect. And then do you have any special dietary preferences or restrictions?
No.
Okay. And how's your appetite been?
Good.
Good. Do you smoke cigarettes or chew tobacco?
No.
Do you drink alcohol?
About a glass of wine a week.
Perfect. And do you indulge in illicit drugs?
No.
Recreational drugs? Perfect. And then how often do you exercise?
About twice a week.
Twice a week for how long?
For about an hour.
An hour, awesome. Do you drink any caffeine?
1 cup of coffee a day.
Perfect. And do you ever use laxatives to go to the bathroom?
No.
Perfect. And do you ever have any situations that cause stress?
No.
No? Okay. And if you were to have stress, how would you usually deal with that?
I really like getting on my Peloton.
Oh, I love that. Awesome. And then how many hours of sleep do you get on average a night?
Probably like 6 to 8.
And how would you describe your sleep? Like, do you wake up well rested?
Yes.
Perfect. And then what do you like to do for fun?
I really like to paint.
Paint, I love that. And then do you have any alternative healthcare things that you use?
Sometimes I do acupuncture.
Oh yeah, okay, awesome. And then do you own a gun?
No.
And do you wear a seatbelt when you drive or are in a car?
Yes.
Perfect. So now we're going to do the review of systems. So how do you think your general health is, Annette?
Pretty good.
Perfect. Have you had any fevers or chills?
No.
Have you had any unexplained weight loss or weight gain?
No.
Have you been feeling fatigued?
No.
Perfect. And then have you had any changes in your vision
No.
or blurred vision?
No.
And when was your last eye exam?
I did it around November.
Awesome. And how were the results?
All positive.
Do you wear glasses or contacts?
No.
Perfect. And then how about your ears? Any difficulty in hearing?
No.
Any discharge or pain in your ears?
No.
Perfect. What about your nose? Any difficulty with breathing through your nose? Any nasal congestion?
No.
Perfect. And what about your throat? Any sore throat, difficulty swallowing?
No.
Perfect. What about difficulty eating or chewing your food?
No.
Okay. And then what about your mouth? Any sores or lesions in your mouth?
No.
Perfect. And when was your last dental exam?
I did it last year. I want to say August.
Awesome. And then what were the findings at your last dental exam?
No cavities, everything healthy.
Awesome. Perfect. And then any recent chest pain or palpitations?
No.
Perfect. Any shortness of breath?
No.
Awesome. Any cough?
No.
Perfect. And then how often do you have a bowel movement, Annette?
Daily.
And when was your last bowel movement?
This morning.
Awesome. And how would you describe your bowels?
Soft.
Perfect. And have you had any recent constipation or diarrhea?
No.
Perfect. And any blood or mucus in your stool?
No.
Perfect. Any painful urination?
No.
Do you feel like you have to go to the bathroom more, or do you feel any urgency?
No.
Perfect. Any joint or muscle pain?
No.
Any difficulty with your range of motion?
No.
Awesome. And then has there been any change in your skin? Any excessive dryness? Anything like eczema, psoriasis maybe?
No.
Perfect. And then have you experienced any tenderness in your breasts or any discharge from your nipples?
No.
Perfect. And have you had any dizziness or seizures?
No.
Awesome. And any depression or anxiety?
No.
Okay. And any intolerance to heat or cold?
No.
Any excessive hair growth?
No.
Perfect. And then do you bruise easily?
No.
Awesome. Or do you have any poor wound healing?
No.
Do you get sick easily?
No.
Perfect. And then just one more time, any allergies to food, medications, or environmental factors?
No.
Perfect. Now we're going to move on to the physical exam. So we're just going to assess for her general appearance. So on my, as I just assess the patient, she appears healthy. She's breathing without any distress. She appears well nourished. She's sitting upright. She's well groomed and without any odor. She moves well. She's awake, she's alert, she's making good eye contact throughout the interview. Her affective mood is pleasant, she's smiling and happy looking. So then we're gonna move on. And then can you tell me the date and the year of today?
Yeah, today's February 17th, 2023.
Awesome. And can you tell me who the current president is?
Yes, I can. He's the older guy.
Or could you tell me who the last president was?
Trump.
Awesome. And then where are you right now?
At the clinic for a wellness visit.
Awesome. So the patient is oriented to time, place, person, and event. So she's A&O times 4. So prior to this exam, we got her height and weight, which is 5'7". She weighs 145 pounds, which puts her BMI at 22.7. We also did some vital signs. Her blood pressure was 118/72. Her heart rate was 86. Respiratory rate was 16. Her temperature was 98.1 degrees Fahrenheit, and her O2 sat was reading at 99% at room air. So after that, we're going to go ahead and assess for her skin. I'm going to be checking her skin turgor, so I'm going to check on her hands, and if I can grab your hands, I'm just going to pinch to assess for turgor on both of them. So there's no tenting noted, which is what we're looking for. We'll also do it on the clavicle, right here in between the sternum. Awesome. And as I'm testing for her skin turgor, I'm also noting the temperature of her skin, which is warm and dry to touch. Her skin has enough moisture, there's no excessive dryness, and I don't see any rashes. So next we're gonna move on to her face. I'm looking, her face I don't notice any swelling or edema, it's symmetrical. The color is appropriate for her ethnicity. I don't see any yellowness, which would indicate jaundice. There's no redness or pallor also noted. Next, we're gonna move on to the hair. So I'm gonna go ahead and have a look at the hair. So I'm looking for the texture, if there's any patches of baldness, any dandruff. I'm also looking to see, so that's what I'm looking for, which everything looks good, no dandruff. And so we're gonna move on to the nails. So if I could have a look at your nails, Annette. So when I'm looking at the nails, I'm looking for any clubbing, any splinter hemorrhage. Luckily, she has some of her nail polish off, so I can check for cap refill here, which is less than 3 seconds. We'll do the same with the other, looking for a clubbing, cap refill, and we're gonna move on to her skin. So I'm looking for any, there's no visible scars, no lesions, there's no suspicious tumors or nevi. I'm also looking for any macules, papules, vesicles, or pustules, which I see none. And if I were to see a mole of any kind, we would follow the ABCDE method, and that is looking for the asymmetry of the mole, the borders, whether they're smooth or irregular, the color, the diameter, and the evolution. So for a healthy mole, we would want it to be symmetric, regular, uniform in color. The diameter would be less than 5 millimeters, and the patient would report that no change has occurred to the mole over time. So next we're gonna move on to the head and neck. So the head is normocephalic, it's symmetrical, which is what we're looking for. Her facial expressions are normal, they're symmetrical, and there's no edema that I can see. So then, as I'm looking at the head as well, I don't see any trauma. The hair texture is good, no lesions, and so next we're gonna palpate. So as I'm palpating her head, Annette, do you feel any tenderness?
No.
So I'm also feeling for any lumps, bumps, any depressions, or anything like that. Perfect. Next we're gonna palpate the temporal arteries, which are on the sides of the ears. So I'm gonna go ahead and palpate. They're palpable bilaterally, a +3 grade, perfect. And next we're gonna palpate for the TMJ. So I'm gonna place my index finger right in front of her tragus. Go ahead and open your mouth for me, and then my finger kind of falls into that groove. Close, open. Any tenderness there?
No.
So if the patient did feel any tenderness or if I heard any crepitus, that would indicate that she has TMJ syndrome. Next, we're going to palpate for the frontal sinuses here. Any tenderness in that?
No.
Perfect. And then we're going to go to the maxillary. Any tenderness here?
No.
Perfect. So the patient doesn't have any tenderness reported in her sinuses. Next, we're going to check for cranial nerve number 5, which is also known as trigeminal. So here we're going to assess for the forehead, the cheek, and the jaw. I'm going to use my little tool that has a dull side and a sharp side, and I'm going to have the patient close her eyes, and I'm going to press one or the other side and have her tell me what she feels. So Annette, let me know if you feel sharp or dull.
Dull. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Perfect. You can go ahead and open your eyes. So she correctly identified both. We're also going to ask Annette if you could clench your teeth for me. Perfect. And then I'm going to place my hand under her jaw and kind of push resistance up and have Annette open her mouth. Perfect. So that is intact. We're also going to test for cranial nerve number 7, which is the facial. So for this one, Annette, can I have you raise your forehead and then wrinkle, or raise your eyebrows and wrinkle your forehead, kind of perfect. And a big smile, puff out your cheeks, and pucker your lips. Perfect. So she's able to elicit all those movements, which means that cranial nerve number 7 is also intact. Next, we're going to move on to the eyes. So as I'm looking at the eyelids, I see that there's no drainage in those areas. I'm going to pull down to have a look at her conjunctiva, which is pink and moist, and at the same time looking at her sclera. There's no yellow, which would indicate jaundice. They are white, which is what we're looking for. I'm also noting the cornea and the iris. We're just kind of visualizing the lens and the pupils. Everything is within normal limits. Next, we're going to assess for pearla. So I'm going to grab my handy dandy pen light. So I'm going to shine the light onto her eye and watch the constriction of the pupil is what we're looking for. So Annette, go ahead and just look straight ahead for me. Perfect, and we'll do the other side. So when I shine the light, her pupils went from 4 millimeters to 2 millimeters. So now we're going to test the concentric. So I'm going to once again shine the light, but look at the opposite pupil. So go ahead and look straight for me, Annette. Perfect, and then again. Perfect. And then lastly, we're going to test for accommodation. So I'm going to use my pen light, and I'm going to start it further away and bring it closer in. So and if you just follow my pen light. Perfect. So as I'm doing this, as I'm getting closer to her eyes, her pupils are dilating, and when I was further away, when I'm going closer, they're constricting, and as I'm further away, they were more dilated. So after assessing those, I can say that the pupils are equal, round, reactive to light, and accommodation, which is pearla. Next, we're going to assess for cranial nerve number 2, which is the optic nerve. So for this, I'm going to need my Snellen chart, my pocket-sized one. And so if it was a real patient, I would be standing 6 feet away, but for the purpose of this video, I'll just be right here. So Annette, I'm going to have you cover one eye for me, and go ahead and read the smallest line that you can see.
It's LTFPH.
Perfect, and go ahead and switch eyes, and go ahead and read again.
LTFPH.
And then go ahead and open both of your eyes and read the lowest.
LTFPH.
Perfect. So according to the Snellen chart, Annette has 20/20 vision in her left eye, in her right eye, and both eyes. So cranial nerve number 2 is intact. We're going to move on to the extraocular movements. In this part, we're going to be actually testing 3 different cranial nerves. Cranial nerve number 3, oculomotor. Cranial nerve number 6, abducens, and cranial nerve number 4, which is trochlear. So Annette, I'm going to have you cover one eye for me. Perfect, and then just have me follow my finger. So first we're going to go assess the oculomotor, which is these ones, up, down, and kind of the diagonals. And then this is going to be cranial nerve number 6, the lateral movement. And then trochlear will be down and medial. Go ahead and switch hands for me, Annette. Again, we're gonna go 3, cranial nerve number 3, oculomotor, 6, abducens, and 4, trochlear. And then go ahead and open both your eyes. We're gonna do it one more time. And with both eyes, down here, abducens, and down, and then 3, 3, 6, and 4. Perfect. So those cranial nerves are intact. While I'm doing that, I'm also noting for any nystagmus, which is the rapid movement of the eye, which is involuntary, which I did not see here. After that, we're going to assess the eye with the ophthalmoscope. So I'm going to do one eye at a time, and we're going to do same eye to same eye. So that means that we're going to do my left eye to her left eye. So I'm going to start further away. I'm looking for the red reflex at first. And so Annette. And then as I see it, perfect. I'm going to go in. Trying to visualize the optic nerve, the vessels in the back. Perfect. And then we're going to do the other side, and I'm going to go right eye to right eye. Looking at the red little reflex at first, and then going closer in. Perfect. So I was checking the retina at the back of the eye, the optic disc, which looks normal and healthy. The cup to disc ratio was about 1 to 3. I'm also visualizing for the fovea, macula, and vessels. I didn't see any AV nicking, no cotton wool spots, or hemorrhage or infarction in the vessels. Next, we're going to move on to the ear. So first off, I'm going to start by inspecting the outer ear. So I'm just looking for any redness, any drainage or inflammation that I may see. Perfect. I'm also going to visualize the inner ear, and I'm looking for any obstruction in the ear canal. Perfect. Look on this side. I'm going to pull the pin back a little bit. Perfect. So there's nothing there. After that, I'm going to palpate. So I'm palpating the external ear for any tenderness. Do you feel any tenderness in it?
No.
Perfect. Make sure we're going to palpate her tragus too. Any tenderness?
No.
Awesome. Once we are done, we're going to go ahead and test for cranial nerve number 8. This is the acoustic nerve, or also known as the vestibulocochlear nerve. So we're going to start off by doing the whisper test. So Annette, I'm going to occlude one of your ears, and then I'm going to whisper a 2-syllable word on this side and have her repeat it back to me. So Annette?
Apple.
Perfect. I'm going to go ahead and occlude the other side.
Baseball.
Perfect. So she was able to say both words, which means that her hearing was intact. Next, we're going to get our tuning fork. We're going to do the Weber test, and for this, I'm going to strike my tuning fork and place it on the top of the head. And then I'm going to ask you, Anna, do you hear the vibrations in one ear or both?
Both.
Perfect. And that's what we want. We want it to be even. If it would be one, that means there would be some sensorineural hearing loss in one ear. Next, we're going to do the Rhine test. So for this one, we're going to use the tuning fork again. I'm going to go ahead and strike it and put it on her mastoid bone. And then let me know when you can't hear it anymore.
No.
Perfect. Then we move it to your ear. Let me know when you can't hear it anymore.
No.
And we're going to do the same thing on the other side. Strike it, put it on the mastoid bone.
No. No.
Perfect. And so we want it to be where they can hear longer on their ear than their bone, because air conduction is greater than bone conduction, so that's a normal finding. Next, we're going to get the otoscopic exam. So I'm going to use this to have a look in her ear. Okay, so I'm going to pull the pin up and back, and we're going to have a look into her ear. Perfect. We're going to go to the other side. We're going to pull and back, and we can use this so I don't damage her canal. Have a look. Perfect. So I didn't see any drainage. There was no obstruction noted in her canals. I was also looking for the tympanic membranes, which I thought was pearly gray, shiny, and translucent. It looked smooth. There was no bulges or contractions. I saw the cone of light in the right ear at 5 p.m. and on the left ear at 7 p.m., which is what we're looking for. So we're going to move on to the nose. I'm going to inspect it visually first. I'm looking to see that it's midline, that there's no deviation in the septum, and that it's symmetrical, which it is. We're going to check for patency. So, Annette, I'm going to go ahead and occlude one of your nostrils. Take a deep breath in. Perfect. And then occlude the other side. Take a deep breath in. So her nostrils are patent. She's able to breathe through them. It's intact. I'm going to use my otoscope now to examine the inside of her nostrils. All right, and if you kind of look up. Put there. Awesome. The other side. Perfect. So as I was looking, I'm looking at the mucosa of her nostrils. They were moist and pink. I didn't notice any polyps or discharge at this time. Her nasal turbinates were lateral and there was no swelling. We're now going to test cranial nerve number 1, which is our olfactory, our smell test. So, and then I'll have you close your eyes for me. Go ahead and occlude one nostril for me. And go ahead and let me know what you smell.
Coffee.
Coffee, perfect. And then go ahead and swap and occlude the other nostril for me. And what do you smell?
Alcohol.
Perfect. So I have coffee and alcohol wipes, and so her cranial nerve number 1 is intact. I'm going to move on to the mouth and throat. So I'm going to inspect her lips first. They look nice and pink. They don't look dry. Go ahead and open your mouth for me. And I'm looking at her teeth, looking to see if there's any, that she has her teeth, if there's anything abnormal. Go ahead and open your mouth one more time. I'm looking at her tongue. It's pink and moist. Her buccal mucosa, which is also pink and moist. Can you go ahead and kind of show me your gums, looking for any inflammation in the gums, which she does not have. Looking at her soft and hard palate, and then the anterior and posterior pillars, which are all, there's no discoloration, no bumps in there, no lesions. I'm also going to look at her tonsils, so go ahead and open one more time. Perfect. So her tonsils are +2 and normal. And then we're going to go to the head and neck. So we're going to, already at the head and neck, we're going to assess for cranial nerve number 9, which is the glossopharyngeal. So Annette, can you go ahead and say ah for me?
Ah.
Perfect. So as she does that, I'm assessing for her uvula moving up, which it did. So that's intact. So next is cranial nerve number 10, which is the vagus. And we don't hear any hoarseness as she speaks. So Annette, if you could go ahead and swallow for me as well. Perfect, so her swallowing isn't intact. And we can also test for the gag reflex, but for the purpose of this video, we will not be doing that. And then we're going to test for cranial nerve number 12, which is the hypoglossal. So Annette, can you stick your tongue out for me? Again, perfect. So I'm looking for any deviation, making sure the tongue is midline. And then if you could push your tongue side to side against your cheek. Perfect. And when we're doing this, we're assessing for the strength of her tongue. So cranial nerves 9, 10, and 12 are intact. Next, we're going to move on to the neck. So we're looking at the neck, we're looking for symmetry, we're checking for if there's any enlargement, any swelling, which I don't notice here. I'm going to palpate the lymph nodes. So we're going to start with periauricular, and then we're going to move to postauricular, and then we're going to do the occipital back here, the tonsillar, the submandibular, and the submental. We're going to do the anterior cervical, the posterior cervical, and then lastly we're going to do the supraclavicular. Perfect. Any tenderness while I was palpating those areas?
No.
Perfect. And I didn't feel any enlarged lymph nodes either, which is great. Next, we're going to inspect for the trachea. We're going to see if there's any deviation. So for this part, I'm going to place my finger kind of where the trachea is and in between the sternomastoid. So I'm assessing for that space right here from this side. Perfect. So I want to make sure that the space is even on both sides. I want to compare and assess them to see if it's even. The space for Annette is the same. That means her trachea is midline. Next, we're going to inspect for the thyroid. So Annette, if you could go ahead and tilt your head back for me, and I'm assessing for the thyroid placement. Doesn't look enlarged to me. I'm gonna go ahead and palpate from behind. So then I'm gonna have to move a little bit. Perfect. So I'm gonna come from behind, and then I'm gonna go ahead and ask you to swallow. Perfect. So as she's swallowing, I'm feeling for the thyroid and the isthmus movement, and I'm kind of palpating for the lateral lobe. Swallow for me one more time. Perfect. So there's no nodules that I can feel, and the thyroid is rubbery, which is what we want. Next, we're going to assess for cranial nerve number 11. This is the accessory nerve. So for this one, I'm going to place my hands against your shoulders. I'm going to push down. If you could shrug for me. Perfect. And then I'm going to place my hand on your cheek, and then I'm going to push resistance if you want to push against my hand. Awesome. And then the other side. Perfect. So cranial nerve number 11 is intact. I'm also going to assess for jugular vein distension. So we usually want to have the patient lay supine and have their head elevated. So Annette, if you don't mind, kind of getting down here for me. Elevate a little. It's easier in the hospital, of course. And go ahead and turn your head to that side. And so I'm looking here for any jugular vein distension. There's none, which is what we're looking for. There shouldn't be any distension. Perfect. Come on up. And come back to the seat. Next, we're going to inspect the chest. So I'm looking for any lesions, any rashes, which she doesn't have, any chest wall deformities such as pectus, excavatum, or carinatum. And then after inspecting, I'm also looking for the symmetry of her thorax. Noting that there's no barrel chest there, that there's no pigeon chest. I'm looking at her respiratory. So I noticed that her rate is about 16. Her effort is unlabored. There's no use of accessory muscles. Her rhythm is regular. Also, I'm not able to hear any abnormal breathing sounds like stridor. Her anterior to posterior ratio is 1 to 2. And we're going to palpate the sternum. So Annette, do you feel any tenderness?
No.
Awesome. Perfect. Next, I'm going to assess the posterior thorax, so and I'll have you turn around. Actually, we have the chair. Yeah, perfect. So now we're looking, we're going to palpate the posterior. We would have assessed visibly for the same things as the front, the lesions, things like that. So now I'm going to palpate. I'm palpating her, actually I'll have you move just a little, like kind of, yeah, perfect. Her intercostals, her back, her spine. Any tenderness in it?
No.
Perfect. All right. And then we're going to look for respiratory excursion or expansion. So I'm going to place my hands kind of along the 10th rib with my thumbs together, kind of like a butterfly on the back. And then I'm going to bunch up the skin. And then go ahead and take a deep breath for me. And relax. One more time to make sure. Perfect. So we want the hands to raise and come back down symmetrically, which it did. Next, I'm going to check for tactile fremitus. So, Annette, every time you feel my hands on your back, say 99. Here we go.
99, 99, 99, 99, 99.
Perfect. And I'm looking for even vibrations on both sides, which they were equal. Next, we're going to percuss. So I'm going to start and go to ladder motion. We'll start over here. Perfect. So all sounds were resonant, which is what we want to hear, and there were no areas of dullness. Next, we're going to check for a diaphragmatic excursion. So for this part, I'm going to have the patient deeply inhale and hold it, and I'm going to kind of start percussing from midline and go down until I hear dullness. So when I go ahead, deep breath, hold in. All right, so right over there, go ahead and relax. So this is going to be one of my markers, and then I'll have you go ahead and take a deep breath in and exhale all the way out. Perfect, and then now I'm going to go up, waiting till I hear the resonance. Right about kind of there. So then I would measure that part, and that would be the diaphragmatic excursion, and that would, we want it to be between 3 to 5.5 centimeters, that's normal, and we would do this bilaterally. Next, we're going to auscultate the lung fields. So I'm going to grab my stethoscope and we're going to move in a ladder fashion just like we did with the percussions. And then every time you feel my stethoscope on your back, go ahead and take a deep breath for me. Perfect. So all breath sounds were clear to auscultation in all the upper and lower lung fields and laterally on both sides. The breath sounds were vesicular. I didn't hear any adventitious sounds such as wheezes, crackles, rhonchi. So that's perfect. We'll have you turn back around and we'll assess the anterior thorax. So once again, I'm going to start off with palpitation. So now let me know if you feel any tenderness.
No.
Alright. Any tenderness?
No.
Perfect. And then we're going to assess for lung expansion on this side too. Again, at that 10th rib, I'm going to have my thumbs match and then kind of bunch up the skin. And then go ahead and take a deep breath and relax. And so one more time, so you see my hands and relax. Perfect. And so they were even and symmetrical. We're going to do the tactile front in the front as well. So and then again, every time you feel my hands, go ahead and say 99.
99, 99, 99, 99.
Perfect. And the vibrations were even and on both sides. Next, we're going to percuss. So same thing as the back. Listening for a resonance. All right, and the resonance could be heard in all of the anterior thorax. And now we're going to auscultate the anterior chest. So and then again, every time you feel my stethoscope on your chest, please go ahead and take a deep breath. Perfect. So breath sounds are clearer in the anterior thorax as well. They're vesicular, there's no rhonchi, crackles, or wheezes noted. And next we're going to move on to the cardiac portion. So I'm going to inspect for any heaves and thrills over the 5 precordial spaces. I don't visualize anything, so we're going to palpate for it. For the heaves, I'll be using the heel of my hands, and for thrills, I'll be using the fingertips. So I'm going to go ahead and start with the aortic, then the pulmonic, Erb's point, both ways, tricuspid, and the mitral. And if there were heaves, we would see my hand lift, and if there were thrills, we would I would notice kind of a vibration under my fingertips, which I didn't notice, so everything looks great. Next, we're going to palpate for the pulses. So we're going to start off, we're actually going to palpate for the apical pulse first. So that's going to be at the 5th intercostal space at the mid-clavicular line. So that's the apex. Perfect. So that it's palpable, it's grade 2 plus. Next, we're going to palpate for the carotid arteries. We're going to do these one at a time, so we don't want to impede blood flow to the patient's brain. Perfect. We'll come to the other side. Perfect. After palpating, we're going to auscultate for the carotid arteries with both our diaphragm and bell. We'll start off with the diaphragm and then the bell. Perfect. And so I don't hear any bruit. And then the bell. Perfect. After that, we're going to auscultate for her heart sounds. So we're going to start off with her sitting, and we're going to do the 5 pulmonic heart sound areas. We're going to start off with the aortic. This can be found at the 2nd intercostal space to the right of the sternal border. So I'm going to do it with my diaphragm. Perfect. And then with my bell. And then we're gonna move on to the pulmonic, which is also the second intercostal space, but to the left of the sternal border. So with my diaphragm and my bell. Perfect. And then we're gonna move to Erb's point, which is at the third intercostal space. It's to the left medial sternal border. So right here, we're gonna go with the diaphragm and then the bell. Perfect. And then we're gonna go to the tricuspid, which is the fourth intercostal space left of the sternal border. Perfect. And then I'm also going to listen lastly to the mitral, which is the fifth intercostal space, mid-clavicular line. Perfect, and then diaphragm, and now we're gonna use the bell. Perfect. And then we're gonna do the same thing with the patient lying down. So Anna, if you can go ahead and lay down for me. So doing the same areas, aortic, pulmonic, Erb's, tricuspid, and mitral with both my diaphragm and my bell. Mitral. Perfect. So I heard all normal S1, S2 sounds. If I did hear a splitting of S2, that would mean that there's an abnormality in the aortic and pulmonic valves closing at different times instead of the same. I didn't hear any murmurs, thrills, or gallops. Now we're going to move on to the abdomen. So I'm going to take that pillow from you and actually have you lay all the way down. And we're going to put this under your legs. This is to relax the abdominal muscle. I'm going to go ahead and pull your top lobe up. So first we're going to inspect. So I'm assessing for the abdomen contour, any pulsations, heaves, asymmetry, skin condition, any scars or hernias. I don't see any of that. So next we're going to auscultate the 4 quadrants. I'm going to start at the right lower quadrant. If it was an actual patient, I would listen for a whole minute, but because of the video, it's just going to be quick until I hear one. Perfect. So vowel sounds were heard in all 4 quadrants. They were normal active. You heard the clicks and gurgles, and it's normal to hear about 5 to 34 per minute. Next, I'm going to auscultate using my diaphragm and my bell for the abdominal aorta. This is right above the umbilicus. I'm listening for any bruits. And there's none noted. So I'm going to move to the renal arteries, which is on the 2 sides of that abdominal aorta with my diaphragm and my bell. And then we're going to move lower for the iliac, again with the diaphragm and the bell on both sides. And last, we're going to go to the femoral, diaphragm and bell. And usually we would do the femoral right onto the skin, but for the purpose of this video, we'll be doing it over our hands. Awesome, so no bruits were heard in any of that, no vascular changes such as turbulence or blood. Next, we're going to percuss the 4 quadrants. So we want to be hearing tympany throughout the abdomen. If you hear dullness, it may indicate that one of her organs are enlarged or there's fluid filled in there. Next, we're going to palpate. So we're going to start off with the light palpation to get her kind of comfortable with the fingers. So any tenderness in it?
No.
We're going to light palpate through her abdomen. And then we're going to do a deep palpation. So any tenderness in your abdomen in it?
No.
Perfect. After that, we're going to percuss for the liver span. So I'm going to start at the right upper quadrant. Well, the location of the liver is the right upper quadrant. So my starting point will be in the right lower quadrant, and I'm going to percuss up until I hear dullness. So kind of right here is going to be my landmark. And then I'm going to go from below the nipple and percuss down in between the intercostal spaces till I go from resonance to dullness. So I'm going to put my hand here. right about here. So then we would take this and we would measure the span of the liver, and it's normal for it to be about 4 to 7 centimeters. Next, we're going to palpate the liver. So I'm going to put my hand underneath you, and then go ahead and relax, and then take a deep breath for me. And then I'm able to hook my fingers underneath, and right there, palpate the liver. Perfect. And I'm looking for the edge of the liver to see if there's any abnormalities. Everything looks fine. It was not enlarged. Next, we're going to percuss for the spleen. This is on the mid-axillary line along the flank. So I'm going to hear dullness on this side. Perfect. And I'm also going to try and palpate for the spleen as well. And usually the spleen is not palpable because it's hidden behind the 9th to 11th rib. If it were to be palpable, then that would mean that it is enlarged. Next, I'll have you sit up for me, Annette. And we'll have you actually have you stand. Turn this, I'm going to palpate for her kidneys down here. And it's also normal to not be able to palpate the kidneys. I'm also going to check for CVA tenderness. So I'm going to find her 12th posterior rib. I'm going to put my hand here, make a 5th. Any tenderness in that? No. Same thing on this side. Any tenderness? No. Perfect. And then we're going to, I'll have you lay back down. I'm going to palpate for aortic pulsation. So I'm going to press deep into that epigastrium on both sides above the umbilicus. All right. Any pain? No. And if she would have pain, that would explain, or that would be indicative of a rupture of that aorta. I'm also assessing for any pulsatile mass or a pulsating feeling in the abdomen. This would indicate that there's an abdominal aortic aneurysm, which I don't see. I'm also going to assess for her inguinal lymph nodes, which is kind of above the pelvic area, and then the femoral ones. So I'm going to go ahead and here. Any tenderness in that? No. No tenderness, and I'm at the inguinal lymph nodes, and then I'm going to feel for her. Oh yeah, I should have said. Yeah, that's it. Okay. And then I'm going to feel for the pulses after the lymph nodes. So I'm gonna feel for the inguinal pulses and the femoral pulses. And they are both palpable +2. I'm going to go ahead and move on to the spine. So Annette, go ahead and stand up for me. I'm going to inspect. I'm looking at the posture from the back and the side. I'm looking at the shoulder and hip symmetry. I'm looking for any lordosis, any kyphosis or scoliosis, which I don't know. I'm going to start at the cervical spine. I'm going to palpate down. Any tenderness, Annette? No. Perfect. And once we do that, I'm going to have you bend forward. This is another tool to assess for scoliosis, because it kind of smooths it out so you can look for that curve, which we don't see. Go ahead and come back up. So we're going to do the range of motion for the cervical spine. We can have you turn this way. For extension, and I'm going to have you look up to the ceiling. For flexion, look down to the floor. I'm going to have you do rotation. So if you could look over your shoulder and the other side. Then we're going to go lateral. Go ahead and put your ear to your shoulder and the other side. And next we're going to do the lumbar and thoracic spine range of motion. So go ahead and hug your arm to your chest for me, and then go ahead and we're going to rotate, turn left and right. Perfect. And then we're going to flex, so go ahead and roll down your arm to your knees, and then go ahead and extend, hugging arms back. And then now we're going to go lateral, so side bend to bend, or side bend, side to side. Perfect. And then we're going to go onto the upper extremity, so you can go ahead and relax. I'm inspecting the shoulders, the elbows, the wrists, the hands. I'm looking for any nodules, masses, deformities, muscular atrophy. I'm looking for any redness, swelling, joint asymmetry, which I don't see at this time. I'm going to palpate. So I'm going to start off with the shoulders. We're going to just do this bilaterally. I'm assessing for any pain, tenderness throughout their clavicle, their coracoid process, the tubercle of humerus, the bicipital groove, and the subdeltoid bursa. In the elbow, I'm looking for any pain and tenderness on the all-crenone process, which is the tip, the lateral, the medial epicondyle. If she would have tenderness on the lateral, that would mean that she has tennis elbow. If it was on the medial, it would be golfers. And then we're also going to palpate the wrist, so for the metacarpal and the carpal bones, there's no to minimal movement. Any tenderness?
No.
On this side, the same. We're also going to now do the hands. We're going to go distal, proximal, the interphalangeal, the metacarpophalangeals, and we're looking for pain or fluid accumulation. Any tenderness in that?
No.
All right. Perfect. Next, we're going to do the shoulder range of motion. So go ahead and raise your arm straight to 180 degrees. Go ahead and bring it back to 60. Go ahead and relax, and we're going to abduct. So we're going to go all the way to the side up to 180. Oh no! And then we're going to come adduct all the way down and across the body. Perfect. We're going to do the elbow. So go ahead and arms front, and we're going to flex, extend, and then you're going to supination and pronation. Perfect. And then we're going to do the wrist, so hands out. We're going to wrist down 90 degrees for flexion, extension, wrist up 90 degrees. And then we're going to abduct, so move the wrist out, adduct, move the wrist in. Same thing with the fingers. We're going to do flexion, so we're going to make a fist. And then extension, we're going to straighten fingers, thumbs out. And then abduction, we're going to put the fingers apart, and adduct, we're going to bring them back. Perfect. I'm going to palpate your upper extremity lymph nodes. So we're going to do the epitrochlear and then the axillary lymph nodes. We're going to start here. Palpate. Any tenderness?
No.
Perfect. I don't feel any swelling, any enlarged lymph nodes. We're going to do the other side, starting with the epitrochlear and then going into the axillary area. Perfect. Go ahead and relax. And then now we're going to do our deep tendon reflexes for the upper upper extremities. We're going to start off with the bicep. So we're going to have you relax and perfect on this side. And then we're going to have you bend over. We're going to do the triceps. Perfect. This one right here. And lastly, we're going to go to the brachioradialis, which is right on this side. Perfect. Here on this side. Perfect. And then we're going to do the sensory for the upper extremities. So I'm going to grab my sharp and dull tool again. And then go ahead and close your eyes and tell me if you feel sharp or dull on your extremities.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Perfect. And then I'm going to radiate I'm going to palpate the radial pulses bilaterally. And they're even bilaterally palpable +2. Next, we're going to move on to the lower extremities. So I'm going to be inspecting her hips, her knees. You can go ahead and have a seat. Her ankles, her feet, and her toes. And I'm looking for any swelling, any deformity, nodules, corns, calluses, any plantar warts, which I don't see any. So I'm going to go ahead and palpate. So I'm going to palpate the hips first. Add her trochanter and any tenderness?
No.
I'm going to palpate her knees. So here, the lateral, and underneath, any tenderness?
No.
And I'm also going to do her ankle, underneath the Achilles. Any pain?
No.
All right, to the other side. Perfect. And then we're going to do range of motions. So, and I'll have you lay down one more time. And then go ahead and I'll have you raise your arm up. This is for flexion of your leg. The other one at a time. Perfect. And that is testing for flexion. I'll have you do abduction. So go ahead and swing your legs out each way. And then abduction, have it come over your other leg. Perfect. And then go ahead and bend your knee at 45 degrees and rotate your hip externally for me and then internally. Perfect. And then go ahead and turn around. And I'll actually have you I'll have you lift your legs one at a time up for me for extension. Awesome. And go ahead and turn back around. And now we're going to check for your ankles. If you could go ahead and dorsiflex for me, and then which is up, and then plantar flex. Perfect. And then I'll have you move your foot inwards and then outwards for your ankle. Awesome. And then for the feet and toes, I'll have you curl your toes up and then extend them out. Perfect. And then for the lower, I'm going to check your strength for the lower extremity. So I'll have you push your hips out or your legs out for me. Perfect. And then put my hand and push in for me. Perfect. And go ahead and try to raise your legs. Perfect. And push down. Awesome. And then go ahead and push against my hands, your feet. Perfect. And then pull the other way. Perfect. Now I'm going to look for pulses. So I'm going to check popliteal pulses behind the knees, which are palpable +2. And then I'm going to do the dorsalis pedis, which is on top of the foot. And they're also palpable +2. And then I'm going to do the last one, which is the posterior tibial pulses, which are here. And they're palpable bilaterally +2. And +3 for all of them. No bounding. They're not weak or thready. And next we're going to do the deep turn and reflexes for the lower extremity. So Annette, go ahead and swing over for me. We're going to start off at the patella. So right here. One more time. The other side. Perfect. And then we're going to go on to the Achilles, which is going to be behind, relax. And then on this side, relax. Perfect. And then we're going to do the Babinski reflex. So go ahead and then we're going to use the back side of this, and we're going to go like this. And if you notice her foot plantar flex, which is what we're looking for, if they were to spread upwards, that would be an indication there was a neurological issue. So next I'm going to do the sensory test. Annette, let me know if you feel dull or sharp. Go ahead and close your eyes.
Sharp, dull, sharp, dull, 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 sharp, 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 dull, sharp.
Sorry, I'm going too fast.
Dull, dull, sharp.
Perfect. And now lastly, we're just going to do the gait and coordination balance. So if you can stand up, if you want to just go over there and walk normally. Perfect. And then go ahead back. If you want to walk heel to toe for me. And then walk on your heels this way. On your toes, that's fine. And then walk on your heels. That's okay. Then walk on your heels that way. And then we're going to do the Romberg test. If you can go ahead and close your eyes and stand like this. You would stay like this for 60 seconds, and we would look for any swaying, and that would test the Romberg test. So that concludes my head to toe physical. Thank you so much.
Thank you.